It's not where you go that puts you at greater risk of coronavirus transmission, it's what you do while you're there. That is a saying that I have heard different public health officials make provincially, municipally, over the months, different variations on that idea, different articulations of it when they've been up at the podium, when they've been giving press conferences talking about, well, the different things we need to do, the precautions we need to take, and the restrictions that they're placing on our lives. And it's an interesting idea, one that I think we should unpack a little bit more, and that can maybe help us figure out, well, why do we have these different restrictions, and do they actually all make sense? So that idea, basically, that, look, it's not just going into a store for 90 seconds and quickly browsing for something and then moving over to the till soon after, paying at the till, only being there for another 90 seconds and then booting it out of there. That is not really believed to be a risk factor by anybody. Nobody's actually saying it is. All of these people, Dr. Tam, Dr. Fauci, they're not actually saying that. In fact, the apps out there, like the federal COVID alert app that Justin Trudeau's always urging people to download, that is only triggered after you have been within 6 feet of someone for 15 minutes or more. 15 minutes or more. Wow. I'm sure at the grocery store, you're at that store for longer than 15 minutes, but if you go to the bookstore or, other independent places where you're just picking up one thing or what have you, are you even there for 15 minutes, let alone in close contact with other individual for 15 minutes? Why are we not hearing this more? Why are we not talking about it more? I mean, every day there are media stories out there saying this many new cases in Alberta, this many new cases in Ontario, and that is kind of the driving thing that we have to discuss. I think a lot of people would actually be surprised to learn that those are the parameters of the app, and those are generally the parameters of things that are actually being discussed by public health officials of what leads to transmission of the virus. And I wish we focused on that more, because that would really help us be able to talk about these restrictions much more. I reported the news that in Ontario, the number of cases that have been related back to retail, confirmed to be related to retail, are 0.1% of cases. Now, there are a whole lot of unknowns out there, so some of those unknowns may indeed be in retail. The number may actually be higher, but that's actually the statistic on the Ontario government website, 0.1% of cases, and yet we have shut retail down. Why is this? And I feel like if we megaphoned much more, the sort of 15 minutes, 6 feet thing and so forth, to really encourage people to understand the things that are the higher transmission points, the higher risk factors, maybe we'd actually be able to be a bit more responsible about these rules and restrictions. I mean, we do have at these press conferences, it's really interesting. You'll hear, say in Ontario, Dr. David Williams will step forward. And if you watch these things, and I know most people are just living their lives, so they're not watching them. They happen at like 1 p.m. Eastern time and so forth. David Williams will talk and he'll say kind of interesting stuff. And then Doug Ford will just get up to the podium and he'll say, it's just not safe. Or this other line he likes to say, we're staring down the barrel of a gun and so forth. So these phrases that are very theatrical and they make for headlines, and then people just get worried and they think that there's just panic to be had, and they never hear the nuance that someone like Dr. Williams or Dr. Tam or whoever were actually saying at that press conference. It's really frustrating right now how we're kind of almost failing to discuss, and the media is failing to cover some of these basics that have actually always been said, but they're kind of slipping away. They're not getting the attention they deserve.